And we're working to learn more about the son of basketball superstar LeBron James, who is being hospitalized after suffering cardiac arrest during practice at USC. We continue our coverage with Dr. Omid Fatemi, Medical Director of Structural Heart at St. John's Hospital in Ventura, Thank you very much for joining us, Doctor. And we want to clarify, you are not part of the team currently treating Bronny, but we do want to get your expertise to have a better understanding of this health concern. Talk to us. What kind of treatment could Bronny be undergoing currently?
First of all, thank you for having me, and thank you for having me give my opinion. First and foremost, I want to let the family know that our thoughts and prayers are with them for a speedy and quick recovery. This type of thing is a tragedy, and we are all wishing them all the best throughout this. I'm sorry about the technical difficulty. The most important part of any sudden cardiac death is the immediate response. And more importantly than anything, I want to encourage all high school and college sports, especially contact sports, to have an AED available and have a CPR trained person at all practices and events. It can save a life. In this case, it may have. I'm not precisely sure what Bronny James had occur. I'm not sure what the details of his event were. But typically after a cardiac event, when you've recovered circulation, then you go to the hospital and you get intensive care, and you have several teams of medical experts taking close caution and taking close eye on you.
Doctor, if you can, being that you are not his actual doctor who is currently working on him, for families of young athletes, I know many parents are currently concerned about all of this. Is there any test for this kind of risk ahead of time?
No, that's a great question. That's actually an area that there's a lot of active research. A lot of athletes, they get screened with the American Heart Association, has a standard guideline for screening where they have a 14-part screening questionnaire. And they look at family history, they look at a physical exam, they ask questions about the patient, things like if they've had any family history of heart events, if they have any murmurs on exam, if they have high blood pressure, things of that nature. And that typically, if they screen positive for those things, then they typically undergo more testing at that point. But this is an area that undergoes a lot of research, because when these imperfect tests don't capture everything, it's a big tragedy when these young people have these big events.
Exactly, and we never know when something like that could happen unless a doctor has already determined that a teenager or anybody could have some potential risk. Doctor, thank you very much for your time. We appreciate it.
My pleasure. Have a great day.
Thank you.